Hello, everyone, and thanks for joining us today. My name is Marianne Gagnon, and I'm the Program and Events Director at Save Your Skin Foundation. I welcome you to today's webinar presentation on living with cancer, survivorship, and mental wellness. This webinar will focus on the experience of cancer survivors and the importance of mental wellness from the perspective of 4 women with unique backgrounds and experiences in the cancer space. Short presentations by our 4 speakers will be followed by a discussion between them with time for questions from webinar attendees. Before I introduce our first presenter, I need to go over a few logistics. Pour ceux et celles qui voudraient entendre cette présentation en français, veuillez simplement cliquer sur l'icône Interprétation au bas de votre écran et sélectionner le français. Par défaut, vous entendrez l'interprète à 80% du volume et l'audio d'origine à 20% du volume. Si vous souhaitez désactiver ou réactiver le son d'origine, cliquez sur l'option Couper le son d'origine. All participants in the audience for today's webinar will be in listen-only mode for the duration of the session. As I just mentioned, during the discussion part of the webinar, you'll have the opportunity to submit questions to be answered by the presenters. So to ask a question, please type it in the Q&A panel, which you can access at the bottom of your screen. If there are any questions that do not get an immediate answer, we will contact you with a reply and any discussion you wish to have after the webinar. This session will be recorded and will be available for viewing in English and French on the Save Your Skin Foundation website and YouTube channel. We'll also send the recording to all who registered tomorrow. All right, that's it for logistics. I'll now introduce our first presenter, Shannon Gaudette, who will talk to us about her experience living with cancer and her physical and emotional well-being throughout. Shannon Gaudette worked with high-risk youth for 20+ years, including 12 years in the Vancouver downtown east side. In 2005, she was diagnosed with melanoma, and she has since had 12 surgeries, 3 systemic treatments, countless PET scans, CTs, MRIs, blood transfusions, and iron infusions. Thankfully, in 2014, after having 4.5 feet of her small bowel removed and with a dozen tumors throughout her body, she was given access to Keytruda, a treatment which over time took care of the remaining metastases and saved her life. Her last surgery was in July of 2018, and her last treatment was in July 2019. She is currently tumor-free. Shannon has been sitting on the board of Save Your Skin Foundation since 2011. Okay, over to you, Shannon.
Hello, my name is Shannon Gaudette. I am 50 years old, and I live in Abbotsford with my husband, Brad, and our daughter, Madeline. Before having our daughter and being diagnosed with stage 4 melanoma, I worked with high-risk youth throughout the Lower Mainland for 20+ years, with the last 12 beyond Vancouver's downtown east side. In 2005, I was diagnosed with a low-risk melanoma on my right upper arm, just shortly after Brad and I got married. After a wide excision, I was told it was all good, and BC Cancer Agency recommended that I follow up with my dermatologist once a year. Thankfully, through a friend of my dad's, I was also followed by an oncologist for 2.5 years. As all appeared well with my health, we decided to try and start a family. But sadly, after a few years of trying to get pregnant and 3 miscarriages, things were not looking so good in the child department. At the end of 2010, the melanoma came back in a lymph node in my right armpit. It, along with 4 other lymph nodes, were removed, but only 1 large one had melanoma in it. I did 3 weeks of radiation and got a PET scan, and again, all appeared well. However, as a result of the melanoma coming back, we ceased our efforts of having a family, and we didn't feel it was ethical to bring a child into the world when my health was unpredictable. It was at this time that I reached out to Kathy Barnard with Save Your Skin and have been closely connected with her and the foundation ever since. Fast forward to the end of December 2011, I found out I was pregnant. I was terrified. However, my doctors had no concerns and told me all would be fine. Once I got my head around it, I was excited and I felt better than I had in a very long time. I was still working on the downtown east side, and Madeline was due on September 27th of that year. Then came May 21st. I was in the shower and my left pinky toe went numb. I was instantly concerned. Over the next week, the numbness moved over my foot and started to go up my leg. I told my family doctor I was concerned about a tumor, but she said it was a symptom of my pregnancy. The following week, I felt like I had the flu. And again, my doctor again said it was just a symptom of my pregnancy. Whenever I'd mentioned my concerns about a tumor, she'd say that my PET scan was good, and as were all the reports from my oncologist. On June 10th, after finding me collapsed in the shower, the third week after my toe went numb, my husband rushed me to hospital, and an MRI revealed 2 large tumors in my brain. As I was decompensating quickly, my husband was told that our unborn daughter and I were going to die. Then they offered to put me on life support until Madeline was ready to be delivered in order to save her. I was only 24 weeks along. Because my husband fought for an option that would save both of us, I was transferred lights and sirens by ambulance to a hospital that not only had an amazing neurosurgery team, but also a NICU that had the capacity to care for an infant at 24 weeks if things went south with me during my brain surgery. My surgery on June 12th was a success. Madeline didn't need to be delivered. We stayed in hospital for the next 2 months. Because of the damage to the tumors did to my brain, I had to learn to walk again and use my arms again, which was challenging, but within 2 to 3 weeks, I could walk without a walker, and I could feed myself and brush my teeth. Madeline was delivered by C-section at 32 weeks. I think because of all the drugs pumped into me and as a result into her, she was a good weight and a healthy, but she did need to be tube fed. I was discharged in the middle of August and started 2 weeks of whole brain radiation on August the 15th. Thanks to Kathy and Save Your Skin, I was educated on the current immunotherapy treatments available. I met with my oncologist to make a plan for me to start ipilimumab in September. On August 24th, we moved into our new house, and Madeline came home from the NICU on August 29th. Just before all of the mayhem, we had sold our house, and friends of ours graciously packed it up for us while we were in hospital. As melanoma is one of the cancers that can transfer to infants through the placenta, Madeline was followed by the oncology team at Children's Hospital until she was 20 months old. She continues to have yearly checkups with their dermatology team. Since 2005, I've had 12 surgeries, 3 systemic treatments, 4 separate treatments of radiation, countless PET scans, CTs, MRIs, blood transfusion, and iron infusions. Thankfully, in 2014, after having 4 feet of my small bowel removed and having a dozen tumors throughout my body, Kathy and my oncologist worked together to get me access to Keytruda, which over time took care of my remaining metastases and ended up saving my life. My last surgery was in July of 2018, and my last treatment was July 2019. Currently, I'm tumor-free. Maddie turned 11 in August and started in middle school in September. Brad and I celebrated our 17th wedding anniversary this summer. And looking back over the last 17 years, I've been so blessed to have the support that I do. The unconditional love and support of my husband and daughter, our amazingly supportive family and friends, my amazing oncologist, surgeons, and radiation oncologist, and lastly, the ship that has sailed me through the fog of the last 11 years, Kathy Barnard. I will be eternally grateful for all of your love, care, love, and support, Kathy.
Wow, thank you so much, Shannon. Your story is so incredibly moving, and you did such a good job of highlighting all the ups and downs and twists and turns, so typical, I guess, in patient journeys, but also so unique to each individual. So thank you once again.
Thank you.
I look forward to learning even more about your story during the discussion portion of the webinar. So I'd like to now introduce our next speaker. Antonella Scali is the Executive Director of the Canadian Psoriasis Network, CPN, a not-for-profit organization dedicated to improving the lives of people with psoriasis and psoriatic arthritis in Canada. Antonella is a registered social worker with a background in direct clinical services and in policy analysis in community mental health in Ontario. She is also the fortunate daughter of someone who has survived breast cancer twice. Today, we've asked her to speak to us about the results of a survey completed by All.Can Canada and implications for mental health and the need for psychosocial supports for cancer patients. All right, over to you, Antonella.
Thank you so much, Marianne, and thank you so much, Shannon, for sharing your story. It was so touching and makes me really motivated about the work that I'm going to talk about. So I just want to acknowledge that. Yeah, I'll be speaking on the findings and recommendations and next steps from a patient-led multi-stakeholder initiative that really is looking at ensuring that people have supports throughout all parts of their experience with cancer. And I'm going to bring my lens of, as Marianne mentioned, a daughter of someone who lived with breast cancer twice, once when I was 13, so just a kid, and again, when I was an adult, and I'll be sharing my perspectives from that lens, and also from my work as a social worker and supporting people undergoing difficulties in their lives. So next slide, please, Marianne. So just very quickly, so that people can know what All.Can Canada is all about and this project that I'm going to be talking about. All.Can International is an international organization that's a hub for cancer organizations globally that really looks at ensuring efficiencies in cancer care. And All.Can Canada is an offshoot, a Canadian offshoot that's supported by Save Your Skin Foundation. And that's really focused on specifically how people in Canada can enter a seamless healthcare system by obtaining a swift, accurate, and appropriately delivered cancer diagnosis to help them achieve outcomes that matter most to them. So I sit on the steering committee of All.Can Canada. So some of the work that I'm going to be talking about today is specifically about the work that the steering committee led. So next slide, please, Marianne. So just to set the stage, I mean, we heard from Shannon and I know everyone has different perspectives to bring, but I just wanted to center this presentation around the patient and caregiver perspectives that we knew existed and that really reinforced for the All.Can Canada steering committee that we needed and wanted to do something to support people, particularly at that entering into the cancer care system stage. So I just wanted to share a quote from somebody that we heard from in doing this work. I'll read one of them because I think it's really important. The specialist just bustled in, said this looks like it could be cancer. You need to go for a biopsy, and then left. This was one of the most emotional moments in my life, and I couldn't even tell what he looked like or tell you what he looked like. The tech was like, can I get you some water? Can I hug you? It was like humanity when I needed it. I get they're busy and time is tight, but I just didn't feel like I was being taken care of by the doctors. I felt taken care of by the staff. So again, it's really just setting the stage about how important that entry into the cancer care system can be for people, and how just those small aspects of feeling supported can make a big difference. Next slide, please, Marianne. So when we so just to give you some background, we did some research, an environmental scan to better understand what are the challenges that people experience from suspicion of cancer to diagnosis. And we conducted we commissioned interviews of patients from across different cancers and clinicians. And what we heard were, or what struck us about this early stage is that there are direct issues that affect people. So needing, practical things like time off for tests, having to make difficult decisions when you're not even sure what's happening yet. The impacts on family can be extremely stressful and disruptive. And other indirect issues related to things like fear, distress, anxiety, and all of everything that comes with it. I remember when I was young, my mom didn't tell us anything. We kind of just found out when treatment started that she was sick, mainly because she was really scared. And when, even as adults, when you think that maybe there would be a different approach to how she engaged with us, it didn't change. She held back until she absolutely had to tell us. So this is obviously a time that's fraught with concern for the individual and has those impacts on the family. And the other thing to kind of keep in mind is that, you know, the mental health system in Canada isn't ideal to support people when they need help. Their wait lists can be very long. Knowing where to connect for support can be very challenging. So ensuring that that support is right there at the get-go for people within that suspicion stage is particularly important, given that we don't have that great net in Canada to help support people along. So next slide, please, Marianne. So just a note on language, because we are talking about mental health and emotions, and just a distinction that you can live with mental illness and experience good mental health, and you can experience poor mental health without mental illness. So when we're talking about mental health, we're really talking about that capacity to think, feel, and act in ways that enhance our capacity for enjoying life and dealing with challenges. And the kind of other end of the spectrum, if you will, there's diagnosed mental illnesses. And everywhere in between, people can experience mental health issues. So just a point on language, just to specify that, you know, these can be situational. When you're dealing with mental health issues, can be situational, and it's very common for people at this stage of suspicion to experience some mental health challenges, no matter what their mental condition might be. So next slide, please. So what we found when we did this research might be familiar to some people, but there were 3 distinct stages in this suspicion to diagnosis trajectory. The early stage is, you know, when you're first starting to engage your doctor and trying to figure out what's wrong. The middle stage can be a lot of back and forth. When we ask people about dug into this a little bit more, the middle stage was often referred to as feeling overwhelming, kind of being not sure what's happening and feeling that stress of having to communicate with different healthcare providers and others. And then the final stage, when getting a diagnosis, was considered to be, in our research, usually where it was a little bit easier for people. So those really early stages where you're just not sure to when you're actually getting connected to the system are fraught with so many stressors for people, according to our research. So next slide, please, Marianne. So what we found, there were a lot of findings from this environmental scan that we did in the interviews that we did. And there were 7 main aspects of diagnosis and outcomes that are critical to a quality diagnosis experience for people from the research. And one of them, which is highlighted on this slide, is integrating psychosocial supports right at the get-go. So right from when you're starting to inquire about your concerns. And so you can go to the next slide, Marianne, and speak to some of the challenges. The reason why we thought, or the reason that came out so clearly to us in this research, is because the current state of psychosocial supports in the cancer care system in Canada is wholly inadequate, if and when it even exists. So currently, a psychosocial support network really depends on where you live, what resources are available in your location, if people tell you about them, so which providers you're talking to. So again, it really just depends on if you're lucky to get access to existing resources. Where they exist, they can be very fragmented. People can be waiting on wait lists for a long time. And by the time they actually get into the support that they're waiting for, they're already further along in their cancer experience, and that pretty initial stage of so much distress has already passed. Caregivers also need support as they assume the de facto role of case manager in many cases, trying to help people navigate this system that you saw in the last slide. And that the need for engagement and integration of these supports is needed at the very beginning and then throughout to support a person to actually help them manage the distress and mental health issues that may come with experiencing a suspicion of cancer and eventually a diagnosis of cancer. So this is again from the people that we've heard from, but if you go to the next slide, Marianne, it was also reinforced by the clinicians that we interviewed for this research. So more than half of the providers that were interviewed for this All.Can Canada research believe that patient supports are essential for a quality diagnosis process. But then only a third of those respondents reported that they actually use the existing supports with their patients. So we don't know why that is, but what we do know is that there's a lot of room for opportunity for the creation of more psychosocial supports, as well as helping people to connect to what does exist in the current system. So next slide, please, Marianne. So some key takeaways. So I wanted to give you some background on what the work is that we did and what we found. But some key takeaways for what you can actually do about this include, cancer takes a tremendous toll on emotions and physical and mental health, as well as for those who care for them and their children, and across all stages, including diagnosis. So a lot of work needs to be done to create a better system of support, which through All.Can Canada, Save Your Skin Foundation is helping to lead. But just remembering that there are resources out there. So we encourage people to connect with patient groups like Save Your Skin Foundation, which offer peer support, educational information, and other resources. Consider mental health resources offered by reputable sources. So All.Can Canada actually launched a hub, including mental health resources information. The website on the page or on the screen. Canadian Cancer Society has a resource locator on their website. We also encourage people to remember other resources that might be available to you, for example, through your employee assistance program and other workplace mental health supports. And also, of course, don't underestimate the impacts of everything you do to take care of yourself and to show yourself and those around you compassion, which sometimes we forget. But again, depending on wherever you are in your cancer experience, just remembering that there are resources out there for you, and there are groups like Save Your Skin Foundation who are fighting to make them even more accessible and have the capacity to support people. So with that, I'll conclude, and I look forward to discussion with the group.
Amazing. Thank you so much, Antonella, for that very informative presentation. It really helps build some context for the rest of the conversation we'll be having today. And I'm really looking forward to hearing more also of your personal insights from the caregiver and social worker perspective during the discussion. Our next two speakers are Kathy Barnard and Lyanne Westie. Kathy is the founder and president of Save Your Skin Foundation, a national not-for-profit group dedicated to the prevention of non-melanoma skin cancers, melanoma and ocular melanoma, and of course, the host of this webinar. In 2003, Kathy was diagnosed with stage 4 malignant melanoma. By the establishment of Save Your Skin Foundation in 2006, her cancer had spread to her vital organs and her treatment options were limited. Fortunately, one of her sons discovered an immunotherapy trial treatment taking place in Alberta, Canada. This trial would save Kathy's life. Kathy was a key player in federal tanning bed legislation for Canada's youth and is the recipient of the British Columbia Community Achievement Award for her leadership in addressing and raising awareness around skin cancer issues. Additionally, Kathy is on the Conference Board of Canada Advisory Committee for Value of Oncology Innovation in Canada. And she'll be joined by Lyanne Westie. Lyanne is a wellness guide and energy therapist with a background in psychology, family studies, and mind, body, spirit healing techniques. Her study and her personal experience have shown her how powerful an individual can be in their own self-care, advocacy, and wellness when they broaden their healing to incorporate mind, body, and spirit. Lyanne works as a wellness consultant for Save Your Skin Foundation, as well as in her own private practice. All right, over to you, Kathy.
Boy, I'm feeling a little pressured that my fellow panelists stayed within their time. Might have to not be chatty Kathy. Hi, everybody. Thanks for attending our webinar. Marianne, could you go to the next slide, please? I always like to tell people I didn't get the job at Save Your Skin by applying and going through any type of process. I got it because I was diagnosed with malignant melanoma in 2003. And as you can tell by this slide, my journey was extremely different back then than it is the journey of today. There were no treatments available. I was given 6 months in 2003. I was given 6 months again in 2005. And I have been absolutely clear of disease, no evidence of disease since 2007. Even after starting the foundation, I had a reoccurrence. I ended up with surgery, put on another compassionate trial. And then I have been absolutely clear. I get scanned every year, but I am incredibly lucky. And I'm so thankful to still be here to present. Next slide, please. That is now, oops, sorry. At Save Your Skin Foundation, most of the work we do kind of replicates some of the needs that I had during my journey. And we know from experience, all of us, that the psychosocial aspects of a cancer diagnosis get less attention than the physical symptoms, but can be equally and sometimes even more debilitating. In 2007, Save Your Skin started working on the mental wellness section of our website for a couple of reasons. Firstly, as a melanoma patient and survivor, I realized late into my journey just how important my mental wellness was, not only but for me, but for my family. I remember before starting my interferon treatment, I was told by the nurse that depression was a side effect and that I should start taking antidepressants. The fact was that being told I had metastatic malignant melanoma was actually the depressant, not the treatment. And at that time, rather than being prescribed those pills, I would have loved to have been prescribed a mental wellness provider. Secondly, when compiling all the feedback from our patients throughout the years for our drug submissions, PCODER, we always ask our patients, the same question: what aspects of this cancer you as a patient experienced? And the answers that scored the highest are always anxiety, fear, depression, and fatigue. We really wanted to know more about the mental wellness piece and what role it played in patients really achieving optimal outcomes. So we at Save Your Skin conducted a survey in English and in French speaking patients across the country. And the aim of the survey was to contribute to the knowledge gap surrounding what affects the experiences of melanoma diagnosis, treatment, and survivorship, and what they have on your mental wellness. We hope that by asking patients the questions related to their mental wellness during their melanoma experience, their survey would be able to offer insight as to which emotions patients most frequently experience, the methods that patients use to improve their mental wellness, and how mental well-being shifts from diagnosis to treatment to survivorship. Additionally, the survey contained questions regarding the demand for institutional mental wellness support, the existing accessibility of that said support, and potential opportunities for improvements within medical institutions and patient groups. Next slide, please. From that survey, we were able to produce a poster that we were able to present at the Canadian Melanoma Conference in Banff. We were also able to present to our physicians, treating physicians across Canada, the findings from that mental wellness survey. Next slide, please. So these comments really reflect the survey findings and truly echo the patient's experiences at the time they are diagnosed. Quite often, we don't hear anything after the word cancer. At that point, it would be so helpful to have guidance on where to seek emotional support as part of our overall treatment plan. Next slide, please. When asking patients at what point in their treatment did they seek emotional support, and we asked them to check all the boxes that applied, 80% said that they wanted it at diagnosis, 73% during treatment, and 50% post-treatment. The percentages in our French-speaking respondents was very similar. And our conclusion from this question was that patients need emotional support from diagnosis through treatment and beyond. Next slide, please. When asking patients if they seek emotional support to help them work through their cancer experience, Only 68% of patients said yes, and that was very similar in the French-speaking respondents. Of the 32 who did not receive emotional support, all wished they had. French-speaking respondents were more likely to seek emotional support. However, they reported greater challenges to receiving that support. Next slide, please. For the respondents that did not seek support, these were some of the reasons why. And again, they were given the option to tick all the boxes. It was because of financial difficulties. They were nervous. They found support difficult to access. They weren't interested, and they didn't know it was available, or they had physical limitations. The survey also asked participants if their family member or caregivers pursued emotional support for themselves. Both the English and French-speaking respondents replied with an overwhelming 79% that they did not. The first conclusion to be drawn from our survey results is that the majority of patients seek emotional support during their cancer experience. The need for support does not appear to be satisfied, especially those in French-speaking provinces. Survey responses suggest that emotional support is seen to be of relatively equal importance at every stage, after melanoma diagnosis, during treatment, and once the treatments have finished. Next slide, please. When asking patients what their ideal support system would look like, again, they could tick all that applied. 35% of the patients said they liked the one-on-one, 27% said friends and family, 26% said group therapy, and 12% said online therapy. As you can see, every patient is unique and will approach their experience differently from others, but all of them require support from one or more sources. Patients assign an incredible amount of power and authority to our doctors. If the oncologist or doctor says, go to this treatment, we'll start tomorrow, and it could save your life, as a patient, we take that as fact, and we trust their expertise. When doctors are giving their treatment recommendation, if the focus is on physical treatment only, patients will see the emphasis on treatment as only physical. If you prescribe a physical treatment and an emotional treatment plan, patients will internalize it and make it a priority. This does not mean that your oncologist has to be the emotional treatment provider. If the doctor or oncologist is the only contact patients have for support, patients will be looking to them for that support, which they may not have time to give, and they are definitely not trained to do. If mental supports are prescribed, the demand will increase, and maybe we would end up with more critical illness, cancer-focused psychiatrists and psychologists, and a database that could very easily be put together for that doctor oncologist to hand to patients as part of their treatment plan. Scientific evidence is available to show that staying positive improves outcomes. That is a very big task to expect someone to take on alone. Physically, a body in fight or flight is focusing on exactly that, fighting or flighting. It is not focused on cell renewal or healing. Supporting the body to stay calm will improve outcomes. If the goal is to support patients in achieving optimal outcomes for their health and recovery from diagnosis to survivorship, mental wellness and professional psychology support needs to be prescribed with the same urgency as physical treatment. Next slide, please. I really want to go back to this slide. I call it the noodle that Antonella showed earlier for a couple of reasons. As you can see, our Save Your Skin survey that we did with melanoma and non-melanoma patients in 2017 showed very similar results to the survey we did with All.Can Canada, which is across all cancers. When putting together a treatment plan, we have to prioritize mental wellness as an essential piece. When a patient is diagnosed with cancer, they are confronted on all levels, physically, socially, emotionally, economically. From the moment they hear the word cancer, their life has changed. They will be facing challenges that weren't prepared to take on. An onslaught of emotions, appointments, decisions, treatments, surgeries, doctors, symptoms, pills, reports, and the list goes on. Putting that right medical team in place is imperative, and that medical team should include a mental health professional. Without a mental health professional, the burden falls on our family and friends who are also coming to terms with the diagnosis. GPs who are already faced with a system that only allows a couple minutes per patient, oncologists who already have their hands full with the task of physically managing the cancer, or to the patient to manage it on their own. The connection between mental wellness and physical wellness is complicated. You cannot treat one without considering the other. Mental wellness is more than just trying to remain positive during a difficult life experience. It is also about mitigating the physical effects of extreme emotions on your body. Over to you, Lyanne.
Good evening, everybody. Just going to check in and make sure that my video is working and that everybody can hear me. Thank you so much for inviting me here tonight. I'm going to spend a little bit of time talking about how our thoughts and our perception affect not only our emotional well-being, but also our physical. And I just want to start first by thanking you, Shannon, for sharing your story and reminding me why I spend time in this space. So knowing that I wanted to touch base on thoughts and perceptions and how they impact our wellness, I decided to see if I could find a quote that would sum that up. And the quote that I landed on was, "Change your thoughts and you change your world." And it made me chuckle when I brought that up, because I thought of how angry it used to make me feel when I was searching for support and I was looking for help and someone would make a statement to me like this. And I just want to remind, as I'm here talking tonight, that I'm speaking from a perspective of how we can put supports in place and how we can guide resources for those that are going through difficult experiences. And again, Shannon, I just want to thank you for sharing, because it reminds me that even though we're doing the work around to help people to change their thoughts and to help them to change their perspectives, in the middle of these very, very heightened and difficult experiences, quotes like this are not helpful. They don't help in the middle of those very, very difficult situations, but they do help us to guide why we put these supports in place. So in this space of how do our thoughts and perceptions impact our wellness, I want you to, if you'll bear with me, just join with me in some imagination. I just want to run through a simple example of how events and perception can be different. And so I want you to imagine that we're sitting in a room together and that I've decided to surprise all of you with a crisp $100 bill. And I walk around through the room and I hand you all $100. And as I'm handing out that $100, you're going to have a reaction to that event. And maybe your reaction is, "Oh, isn't this amazing? $100. I'm going to go to dinner with my family tonight," and you feel good. You get this sort of response that creates a good feeling in the body and you're smiling. Maybe you receive that $100 in your hands and you think, "Actually, I don't need this, but I know somebody that does, and I'm going to give that to them. They're going to be so excited when I hand that to them." And again, you get this sort of up feeling, or your way of perceiving leads you to feel good, get that warm feeling in your chest. And maybe you get that $100 and you think, "I'd really like to go for dinner with my family tonight. That sounds a lot of fun. Oh, will I be able to afford, dinner for the four of us on only $100? Inflation's really tough. Maybe $100 won't be enough." And in that moment, you might find that you feel kind of down and you think, "Oh, $100 isn't what it used to be." Or maybe you think, it doesn't matter. This is going to be so much fun. I'm going to go out for dinner with my family and I'm really going to enjoy this. Right? There's a possibility that one direction or the other could be where you find yourself. Or maybe you think to yourself, "Why is she talking about money? I just got my mind off of money. I thought I'd come here and listen to a different topic, and now I'm thinking about this line of credit," and the mind starts going, right? We find ourselves in a difficult position. And in all of those settings, in all of those responses, right? Maybe there's some others that you find yourself experiencing that make you feel happy, or maybe the imagination of receiving that $100 makes you feel sad. At the end of the day, everybody experienced the same event. Receiving the $100 was an event. How you perceive that event, what you experienced, the thoughts that came to your mind led to a very unique and very different reaction. And those reactions lead to very physical responses in the body. You may feel good, you may feel bad. And this is very challenging when we're looking to put together supports, because all of those reactions, all of those perceptions are going on within the individual. So even though I might know what the event was, maybe it's a doctor's meeting, or maybe it's that initial diagnosis, even though I might know what the event is, I have no idea what the individual is experiencing. And so from a place of supporting wellness, or from a place of being an individual support for others, I recognize anytime I'm setting in to talk to someone or meet with someone to be a support for someone, I don't know what they're perceiving. I don't know what they're experiencing. And so how can I be a support if I'm not hearing from them? And so the great thing about the fact that our perception can change how we feel and how we experience what we're going through is that even though we can't always change the events, we can't always change what we might go through during a difficult experience in our life, and of course during a cancer journey, we can't always change the events. There's very few things that we likely feel we have control over during this time frame. But we do have, with support, and when we get the right networks in place and supports in place and guidance in place, we can work to support the thoughts and perceptions around the event to encourage a more peaceful, a more cared for experience. Because again, we recognize the mind can be our greatest ally, or it can be our worst nightmare. And so one of the things that it reminds me of, again, as we come back to how best to support individuals during this process, is how do we create environments where we can give them space to share their perceptions, to look at how they're experiencing and how their sense of what they're experiencing can lead them to either suffer or thrive through this experience. And so if you don't mind, Marianne, switching ahead to the next slide. So this is one of my favorite images, and it really does it sticks in my mind as I move through the space of putting together resources and being a caring support for, my own patients and clients in this space. Is the moment you change your perception is the moment you rewrite the chemistry of your body. And of course, the event here being the bumblebee, the perception and the response being completely different responses with completely different emotional and physical reactions. And so in order to be a support, we really need to, and I'm going to switch back to Kathy here in just a moment, how then do we give patients a space to be heard? How do we give patients a space to communicate what they're experiencing, the beliefs, the perceptions, the thoughts that they have going on inside, so that we can help to nurture them, support them, help them shift those thoughts and perceptions where possible, to leave them feeling more empowered, more resilient, more able to be with the difficult experience that they're having. And so I'm going to shift back to Kathy, because Savior Skin Foundation has some incredible programs in place to give patients a space to grow in these areas. So Kathy, switch it back to you.
Thanks, Lee. Most of you on this webinar have probably been in touch with Save Your Skin at some point throughout your diagnosis. But I just wanted to share with you why these sorts of webinars are so important to us. Firstly, I realize that we are all very unique as individuals, and our experiences throughout this process are totally different. I don't think in all the thousands of patients I've spoken to that any two have been alike. And that's why at Save Your Skin that we have so many ways of not only supporting patients and their families and caregivers, but we always want to hear from you. When I was first diagnosed, honestly, I was told not to go on, the web. And of course I did. Went on to the Google Doctor Guide. And I think the hardest thing for me was I didn't find any support, and there was absolutely nobody for me to find. And then the information I did find was so outdated. It was, I think, even worse than, not finding anybody. So I made it my mission at Save Your Skin that everything we share will absolutely be driven by patients. Patients of 10 years ago, patients of yesterday, patients in tomorrow. And everything that we produce will be absolutely current and will hopefully be a good resource for our patients and their caregivers. So we have a document that we generally send out to patients when they reach out to us. We have an incredible Melanoma Connect Facebook group that actually, we call it actually our melanoma family. We all have really gotten to know each other throughout this process. We do monthly groups, patient support chats. We do one-on-one support. I think most of you know I have a 1-800 number that I pick up 24/7. I remember what it was like as a patient to try to be reaching out to somebody and nobody responding to me within weeks and months. We now have, because of these wonderful innovative treatments, we now have survivors, and we have an I'm Living Proof map where patients can now share their story on the I'm Living Proof, and we can actually connect patients with patients. We do patient roundtables 2, 3, 4, sometimes a year. That's our way of coming back to our patients and saying, please tell us what you needed yesterday, what you need today, and what you think you might need tomorrow, because we will absolutely try to build all those resources and address your needs either tomorrow or in our next year's plans. We do webinars like this that we hope are helpful for and to our patients. We have a number of online and print resources. We still go to community events. We are one of the organizations across Canada that actually helps financially, and it can be anything from parking to travel or accommodations. We don't ask you for financial statements. If you're a patient and you come to us and you need something, we will do our best to get you that. I always say there is no ask too small, no ask too big. And we do a lot of advocating, and I mean, not only at the patient caregiver level. We work with the federal government, all provincial governments, all decision makers. Our mantra is don't decide anything for us without us. We are well known across Canada as having a very advocacy, patient-centric voice. And I have to be honest, we have made some huge inroads in melanoma, non-melanoma, and ocular melanoma since we started in 2006 because of our relationship with some of the decision makers and the health technology assessment people across this country. So I'm going to thank you again. I'm going to pass it back to Marianne for our panel discussion.
Amazing. Thank you. That was such an informative presentation. I feel like I learned a lot about what patients go through and what tools and support are out there for them and what we need to do going forward as well. So we're now going to move into the discussion part of the webinar. We have about 40 minutes for this, but we're going to try to leave about 15 minutes at the end for questions from webinar attendees. So again, please write in your questions in the Q&A panel, which is at the bottom of your screen. If you're listening in French, you can write a question in French and I'll be happy to translate it. Okay, so I'm now going to turn off this presentation and everyone can, our 4 panelists can turn on their cameras. And I'm going to start the discussion off with a question for Shannon. Shannon, can you tell us when you started identifying as a survivor and how you felt about that label and maybe even how you feel about that label today? There you are.
Okay, so
Awesome.
the term survivor?
Yeah, do you identify as a
it's-
survivor? When did you start?
That term I've always found a little bit tricky for me because I believe that I'm surviving right now, but I look at it more as I'm living with melanoma and currently I'm tumor free. So I'm living well with melanoma because I don't believe that I'd like to believe I am done with this, but I talked to Kath about it a lot because the survivor I think to me would be like a complete eradication of any melanoma in my body. But I believe that even though I'm tumor free right now, I believe I'm still living well with melanoma because it's I get scans every 6 months, MRIs and PET scans, and I'm hoping that I can live with tumor free for many, many years to come. But the survivor has always been a bit of a tricky word for me. I don't know why.
Mm-hmm. What about you, Kathy?
Oh, I agree. I used to just call myself Ned because I don't know, that was a safe place. I was worried if I said the word survivor, that would somehow jinx me. But then after like 10 years, I thought, okay, maybe I'm not Ned anymore. Maybe I'm just living with melanoma. So that's really what I kind of classify myself as. I still need to be scanned yearly. So it's not like I can ever put it in the rearview mirror. Maybe physically I can, but emotionally I absolutely cannot. It was about 5 years ago, though, when I went to a conference and one of the American doctors who'd been treating in melanoma even before I was diagnosed got up, and when he presented, he said, I would have to say Kathy Barnard is cured. And I think that's the first time it gave me the opportunity to think, oh my gosh, maybe I am a survivor. So now I feel a little bit better using the word survivor, but I'm still not going to the cured one. I'll wait for another 10 years before I go there.
Antonella and Lyanne, you both saw someone very close to you go through cancer and move into survivorship. And Lyanne, I'm not sure we mentioned this, but you're the niece of Kathy. As caregivers and professionals in the space, what do you think is the most challenging part of survivorship? And when did you allow yourself to start thinking of your loved ones as survivors? And what was that shift like? That was a long question, but Lyanne or Antonella? Go ahead, Lyanne.
It's interesting because it's such a difficult space. It's such a difficult space to figure out how to be a support through this journey, right? It's one of those things where you're dealing with your own emotions. You're loving someone who's going through so much. None of us are really, unless we spend our life trying to figure out how, learning skills to be a support. And that support changes. We learn it as we go, right? And I don't think anybody, in this space of going through to survivorship, right, Kath, things change so much, and we grow in how we support each other through that space. And I would say that nobody signs up for cancer hoping that they'll grow in their emotional skills or that they'll learn how to relate to each other more intimately. But going through something like this together, we grow, we learn, we don't have another option, right? I think of when Kath first got diagnosed, my belief was the only way I could be of help to her is if I could fix it for her. Well, that's not going to work out well. right? How do you be there for someone if you only think that fixing them is the option? But we learn together there's other ways to be of support. We learn together there's other ways to communicate. So I know that wasn't entirely on the survivorship aspect, but I think the recognition is no matter where you're at in your journey, it's about the relationship and the capacity to learn to be better supports for each other.
Yeah. Thank you.
Thank you. I'm listening and like feeling so much. So I really appreciate everybody on this panel for the record. My experience, it's interesting because I think I always saw my mom as a survivor from the point where I was young and I was just afraid that she was going to die. That was what I recall the most, right? So I think when she didn't, I was like, oh, it's better. This is better. Mom is better, right? So it's as a kid, it's really interesting to reflect on it now, because as I got older and more knowledgeable about how this works, and I hear what Shannon and Kathy were saying. I mean, my mom's experience is very different, but I don't think she would classify herself as a survivor. And in fact, I'm going to have this conversation with her because that rear view mirror, you're always still looking. And when she had her second experience in 2014, it was far less grave than the first time. They caught it very early. They were able to do a single mastectomy, but it was horrible to watch her go through that because she carried that past with her. And then I saw that past, and I could experience it so much differently. I still felt almost as helpless as I did as a kid, in some ways, to be honest. But I think I really appreciate what you said, Lyanne, as well. Like, it is a learning experience for me too, because I really do think that when you're really close to somebody who goes through something like that, you're constantly a support. Like you just are, because you've been through something with them, not what they're going through. Of course, you'll never have that, but being that close with someone, you just you're kind of there. You're there no matter what happens, knowing that this is that history that they keep with them, and I keep with me. And I will say one small thing too. Like I said in my bio, I feel like a fortunate daughter of a survivor, and I really do, because I do think every day is an extra day I had with this person who I cared so much about, and I continue to care for, in this realm. And it's very lucky. I still look at it like that, even though it's like decades later. I still think of it like, wow, I'm lucky that I had all this time with her, that I really felt was threatened at that stage. So yeah, I think it's a continuous experience, and I am going to ask my mom what she thinks about the word survivor, because I'm very curious now.
Mm-hmm. Thank you. Yeah. Shannon, I'm curious. So we talked a lot about mental health supports and their importance. And I'm curious about your, personally, when did you feel that support for your mental health was most important? Was it more at the beginning? Was it near the end? Was it throughout the continuum? And who were the people who supported you? Were they healthcare professionals, advocacy groups, friends?
Definitely throughout, from the very beginning, because I remember before I got my diagnosis, like the early diagnosis in 2005, I was driving home from work and I heard about this lovely gentleman, Chet Cadman, that Kathy knows. And I heard for the first time, this was after I had my mole removed, that he had died from melanoma, skin cancer. And I remember thinking, I didn't know you could die from skin cancer. So when I got my diagnosis in 2000, and just literally 2 weeks later, I just thought I'm going to die. And my dermatologist wasn't much help in kind of quelling that fear. He basically just says, oh, just go and look online. So I instantly reached out to counseling through BC Cancer Agency. And then again, when it came back in my lymph nodes in my armpit, I went to a cancer agency in Vancouver, and then have continued it all through in Abbotsford throughout my whole cancer journey. And also, but really, I think it's just my daughter just has been a huge, she's downstairs, she went, oh, because I didn't have a lot of time to feel sorry for myself, really, because I had an infant and then a toddler, and and I think my family and Kathy and all of those amazing people in my life were just, if I ever needed to talk, I could phone Kathy, I could go see my counselor. I didn't talk to my husband a lot about it, or my mom and dad, because it was too close for them. My deepest fears and concerns, I think that would have been too terrifying for them to hear that. But and my horses, I take Madeline when my parents had a farm out in Aldergrove for 20 years, and my 3 horses were there at the time, and I would just go sit and just groom them and just be with them. And to me, that was huge therapy and good for my mental health. And I got my head around the fact that it didn't happen for any reason. It was just happened. And I got my head around the fact that it happened to me. If there was a reason it happened, it was to help other people get through this. And that's what kind of got me through.
Wow,
So.
Amazing. Yeah, awesome. Thank you. Lyanne, like I said, you saw your Aunt Kathy go through this life-threatening cancer, and I'm curious who you went to for support, and what would have been better in that instance, maybe.
I didn't. I was in my 20s and in all sorts of my own challenges. And it just wasn't encouraged. It just wasn't something that I thought we were meant to do or knew to do. And I think in that perspective, maybe still mental wellness was not on the forefront of what we knew we needed. And so there would be a weird feeling, I think Antonella touched on this a little bit too, like a weird guilt around, who am I to be going and getting help with my emotions around this when somebody I love is really going through it. Like, that's so selfish. I'm not going through what she is. How could I be having intense emotions around this, right? And so I think that there can be these hurdles to getting support that are just part of how society views mental wellness, how we're used to navigating it in a family. I think that if I were to do it differently, if we were to know to do it differently, I would probably be inclined to find ways to support in either a group setting with a family where you're guided in safe conversations. We are not counselors. Emotions are very, very difficult. I don't know how it goes in your families, but emotions get the best of us. It's not an easy space. And so I think that if I could have gifted us anything at that time, it would have been to, as a family, a little bit of humility to say, we don't know what we're doing. We don't know how to do this. Let's get someone from the outside in and be more honest about our limitations in this area. So,
yeah. What about you, Antonella? Same question. Did you go to anyone for support? And would something have been better in retrospect?
I definitely think things could have been better. I will be honest, this is probably the first time I'm talking about this from a personal perspective. I think maybe I've talked to a friend about like true feelings about how it went for me. But I hear you, Lyanne. It was, I guess what I could say is my family was lucky because we have family. We had people around at least. We didn't talk about it either. I don't know that we even knew that was an option. As an adult, I work in this field, and I think the reason why I'm even able to understand and think about my emotions myself in this, in regard to how I feel about my mom, is because I work in this space. I don't think my other family members are reflecting or would be capable of really, naming emotions around it very well. What I can say is, as far as what I would have done differently, again, I'm speaking from a very specific lens, but support for kids whose parents are going through this might have been great. I had my first panic attacks at that stage in my life. I didn't know what they were, and I didn't know what to call them. Now I really do. And, I have a lot of knowledge about how I could have managed that better. But at the time, there was really no understanding. And I'm sure still today, depending on, again, people's comfort level and just accessibility, knowledge, privilege, even to be able to think about these things, matter. So I would say when we're talking about supporting the individual throughout the entire cancer experience, thinking about those particularly vulnerable family members like kids may be an important piece of that too.
Yeah, absolutely.
Yes.
Kathy, you were diagnosed 19 years ago, and your last treatment was in 2007. When you talk to patients today, how is what they're going through now different from what you went through 15 years ago? And like specifically in regards to mental health needs, have they changed, in your opinion?
I don't know if they've changed, but they're totally different. When I was diagnosed, there was no treatment. So it wasn't like I had to get my head around which treatment I should have. Today, as you know, in 2011, all these new drugs started coming to the melanoma cancer people first, before any other cancer. And by 2016, 17, we had an influx of treatment. So now patients are having to sit with their clinicians and trying to figure out which treatment's best to start, if it comes back, which treatment next. Like, I honestly don't know if no information was easier for me than too much information. I don't know now what would have been better or worse. And I think that's why it's important for us at Save Your Skin that we kind of give the patients everything they need to make those really informed decisions, because I think that's really important. But can I go back to something that everybody said? And, you talked about how we grew through all this. If somebody said, how did you do as Kathy Barnard, matriarch of the family? I did terribly throughout this. I didn't realize I needed help for everybody or anybody, including myself, till after I was done. And to me, it was too late, way too late into this game. When I was diagnosed, I didn't tell people, I didn't take my family with me to treatment. I just wanted them to have a normal life. I had lost my dad to cancer, and I did not want to share that experience with the people I loved. Did not. Lyanne was off in her 20s. My kids were graduating from school. I just wanted their life normal. And in hindsight, when we talk about it now, they wish I had included them more. Right? They kind of felt like I just left them in my wake and just went on my, experience on my own. And what I do hear from families, and I'll be really honest, the ones that don't bring in professionals for either their caregiver, their children, whoever, sometimes those families can crack and break. And it's really, really hard to fix those cracks, right? They've been through, and Antonella, you know this. My kids didn't go through this once. They went through it 3 times. It was a repeat of performance of almost losing their mom, right? And I can't imagine how they even got emotionally and ready for this constant whatever. I mean, and so honestly, I think I did it wrong. I wish I had have known what I know now, because I would have had somebody right out of the gate that was speaking with all of us.
Can I jump in just quick as a social worker? Kathy, you didn't do anything wrong. There's no wrong.
I was like, no,
there's no wrong.
But you feel it's wrong, right? Because as a mother or a parent, you're trying to fix everybody. So it just shows. That's why I love these panels. Lyanne, you were trying to fix me. I was trying to fix you. Antonella, we're all trying to fix each other. We don't know what we're trying to fix, and we're really stumbling over each other. And that's where a professional can literally walk us together through this. And then we do grow together instead of cracking. And I think that's the importance of these conversations.
Totally.
Mhm. Shannon, I'm curious, we've
Two.
talked about seeking help from professionals, but are there activities, things that you do or that you did that you turned to in order to help you sort of shut the cancer off, so to speak, when you needed a break from the worry or the anger, confusion, all the emotions that come with cancer?
Um,
You
I'd say
mentioned your
just,
horses.
yeah, the horses was huge for me, and animals in general was huge. And I remember when I felt I was okay, when I was in hospital recovering at Royal Columbian, I took advantage of a lot of the volunteer services, and
Mm.
one of them was the dogs. So Sasha, our dog at the time, was 9 years old. So when I got out of hospital and I felt I was okay to do it, her and I got certified as a therapy dog team. So just that contact with animals, and I continued my counseling at BC Cancer Agency in Abbotsford, and really just spending time with Madeline and Brad, and just taking trips and going away, and that helped. The physical removal from here, going somewhere else, was very therapeutic for me, I found. Yeah, I guess that's kind of what I did to cope. And when Madeline first came home, I was still in that really terrified stage. So it would be, I just want to see her go to preschool. And I lived my week in like 2-week chunks because I really didn't know what was ahead of me. And then I got to see her and then kindergarten. Oh my God, she's in kindergarten. I'm still alive. And then as time went on, and now I don't even think of that. But what I do think sometimes, and I just reached out to my counselor again, I haven't seen her in about a year, is, every time you have a scan, there's that anxiety. Kath knows that still, even though she's farther out than I am by far, but it's still that waiting to get the scan results. So that's always a time when it's going to, and I don't think that'll ever change. My MRI and my PET scans, it's just brings you that sick feeling of until you get the results that you want. But, yeah.
Yeah, thank you. I'm going to ask you one more question, and then we're going to go to questions from the audience. This question is to Antonella and Lyanne. I'm wondering, this is your field of expertise. So in your experience, what has been helpful to people going through emotional challenges?
I can start, Lyanne, and then I think it's been said by Lyanne and by others, it is really the individual, and it comes down to what their needs and experiences are, and that can change over time. Like we've been talking about, this is something you live with in your life, whether it's acutely, like Shannon and Kath are talking about, or just more, hypothetically, like my mom, and you're living with this, right? So you may have different needs that come up at different times. So I think just one important thing is to remember, like, not to put expectations on yourself in terms of what's normal, or, why am I grieving now when this happened 10 years ago, or, I don't have a scan coming up, why am I anxious? Like, just recognizing that your needs may evolve, and emotions are complex, and are how we cope with traumatic events is complex. So really just listening to yourself, reaching out for support when you need it, I think is a really important thing to remember. In terms of what kind of supports, again, that really does vary. It could be the animal support, those personal things that you have that are really important to you. It can be reaching out with family and friends. And like I mentioned, just remembering that there are options for you to access reputable resources. We have some great resources on the hub that I mentioned. I mean, just one simple thing that we engaged in a couple of years ago was a mindfulness-based stress reduction program. It's a free program. It's all been recorded. It's 8 weeks. You can take your time and do it to learn about mindfulness, and just how you can learn those skills now, and then later when you need them, you've done some work to just prepare your mind for how you look at things, the way Lyanne was talking about. So that tool is accessible on that hub site, in video format. So there is stuff out there. So if you're feeling like, there any point in your life dealing with this, you're feeling like you need that outside support, don't be afraid to reach out. I mean, Kath has a number you can call, literally, but there are great resources out there. And I would just encourage people to be patient with themselves and to listen to themselves and know that this is an ongoing experience.
Can I add one more thing?
Yeah,
I think has been invaluable, like just amazing for me, is Save Your Skin has such an amazing community of people dealing with skin cancer and ocular melanoma. And it's that group of people is so amazing and so positive. And we get together. We haven't got together because of COVID for quite a long time, but it's that group. It's like a second family. And it's you all know what you're going through, what you're thinking, and it's just that has been really, really helpful for me. So
amazing.
I think I would echo exactly what Antonella said. Whether you are individually going through something or whether you're a caregiver or looking to be a support for somebody else, I personally like to go in with these two ideas. I don't know what the other person needs, and witnessing. So if we step into somebody with an open mind and an open heart and we go, I don't know what they need, but I will witness and I will listen and I will give them a space to get what's in here out. They have the answers. They know where they're at. They'll communicate it, right? So whether you're a support that's there for someone else, I don't know, but I'm here to help witness. And even Antonella brought up mindfulness. I love mindfulness. It's something to get used to, but mindfulness allows you to be a witness for yourself. It allows you to go, I don't know what's happening here, but in a space of mindfulness, I can witness myself more compassionately, more openly, more truthfully, so that I, in my own time, can hear what's in here and move it out so I can get myself the right resources. So I lead with an I don't know mind. Yeah.
That's beautiful. Yeah. Well, yeah, super, super powerful. Well, we have lots of questions from the audience. I'm going to start with this one. It's addressed to Kathy and Shannon. So what practices outside of your conventional treatments did you find extremely helpful in your healing? So it could be, they gave examples, special diet, holistic practices such as Reiki, therapy, exercise. So I know both of you have already addressed this, but do you have anything to add? Any other practices that you found helpful?
Well, most of you know mine is exercise. Anytime I can go out and hit a ball of any shape, size, I'm happy. But I will tell you, well, firstly, I'm Scottish, so you might as well write the diet off, because if it isn't white and fried, it didn't. I'm a little bit too old to know what Reiki is, so I have to pass on that. But I have to be honest, I surrounded myself with little humans under the age of 8. I've loved being with children my whole life, and I managed to pull that energy from them. I volunteered in kindergarten classes. I coached girls softball. I did anything I could to surround myself with their energy. And the reason I did that is one day I picked up my little great nephew from kindergarten. It was Terry Fox Day. And he got in the car and he said, Katie, did you know Terry Fox had cancer, lost his leg and died? But that's not going to happen to you. Can we go get some ice cream? And it took me from knowing I had my scan the next day and being so anxious, I think we call it anxiety, to going for ice cream. And it just brought me back to the place I needed to be. So I have to tell you, the energy of all those little people was like life-saving for me. They were my therapy.
Yeah, and I didn't do anything holistic or natural, or I just did my traditional treatments, my radiation, and and like Kath, for me it was being in nature, like getting out in nature, getting out with my horse, getting out, just spending time with Madeline, because she just to put a smile on my face all the time. So yeah, nothing, it just was pretty simple. And then seeing my counselor at BC Cancer Agency when I needed to, it wasn't like a scheduled thing. It would just be as I needed to. Connect with Kathy, connect with all the other Save Your Skin patients. But as far as like personal health, like what I was eating, I drank my red wine. I ate what I wanted. And I was a pretty healthy eater anyway, but I just really just kind of lived my life as I normally would. And then I'd have my treatments and stuff. But I made a point of connecting, I think I probably made a point of connecting with people more, because I had a couple times in my journey being told that I wasn't going to make it, and just realizing how important even people that I had disconnected with before, I reconnected with some pretty amazing people. So just those kinds of things, and seeing the value of those relationships. So anyway.
Yeah, that's super helpful. Thank you. So we have a question here. From the standpoint of bringing mental health and wellness to the forefront as part of a cancer diagnosis, are there certain institutions or regions that are doing it really well? And if so, what are they doing to better support patients differently now than in the past? Does anyone want to speak to that?
I can kind of start, but then I may turn it to Kat. So the work that the All.Can Canada environmental scan or research did look at some great examples of initiatives that are best practice or like effective. But I don't work in oncology, so I work in a different space. But what I can say is, my understanding is that it's not consistent and it's not ideal. None of these are ideal. Nothing's perfect. There are snippets of best practice across Canada and across different cancer centers in Canada, but there's opportunity to kind of learn at initiatives that are working well and to scale them. In the research that I talked about in the actual final report, there are those examples that were pulled out as here's the best practice for, integrating psychosocial support or other examples of important outcomes for that stage of the cancer experience. But again, I think that they're just, they exist in pockets, but even within a specific region, they can often be disjointed or hard to access. But that's just my outsider kind of looking in perspective. And I would encourage the person who asked that question to check out that research report if they want to kind of dig a little deeper into promising practices.
Yeah. And maybe I'll include the link in the email that I send out to attendees tomorrow.
And can I just follow up a little bit too, because you're absolutely right. They weren't ideal before in any way, shape, or form. And then we got COVID. And then our resources that were already not ideal were literally stretched to the limit with people who had been, home in isolation, whether, with cancer or not. I can't even explain how debilitating that was for cancer patients throughout those 2.5 years. And so now what we're hearing from patients is those resources are getting, they're just stretched to the max. So, I mean, even being able to find somebody in a timely fashion is really, really hard. And I think that's, a big job that we're all working to do as cancer organizations across the country, is trying to help build those resources back and really be able to find those best practice locations and professionals to get them to our patients as quickly as we can.
And one quick thing I'll say just for hope is that it sounds like, and because of the work that groups like Save Your Skin Foundation are doing, it sounds like there's more of an acknowledgement of the need for psychosocial supports. Is that right, Kath? Do you see that as well? At least people are talking about it now, whereas absolutely. I believe that's relatively new in terms of common discussion and priority.
No, exactly.
Okay.
And I think
another
just
go ahead.
Part of the problem is, I know for BC Cancer Agency, I've been lucky because I don't see my counselor all the time. So she's been able to expand my access to her for a while. But I know that in the initial consultation with a cancer patient at BC Cancer Agency, there's a very short-term amount of sessions that they get, and then they often refer to the community. And that's where I think it's because unless you go through local mental health, the costs of getting connected with a psychologist or psychiatrist, or not psychiatrist, but a psychologist or a counselor is very expensive, and a lot of people can't afford it. So unless you have like an employment assistance program, but a lot of people don't. So that's another, it's the cost of it that's really, it's a lot of money.
Mhm. Okay, so next question is addressed to Kathy and Shannon. It says, I didn't realize melanoma could be passed on to the unborn child via placenta. It is strongly possible that I had melanoma in 2016. We're assuming the biopsy was misdiagnosed, but stage 4 diagnosis confirmed 1 month ago. I had 2 children in 2016 and 2017. What should I do to ensure proper follow-up now that they are 4 and 6? Things to watch for.
Well, I can speak to that. So I wasn't aware of that either. And I had a doctor when I was in HAU came up to me, and I didn't have anyone around me, and I still couldn't move. I was dead weight. And my husband wasn't there, and she came in and told me that there was a 20% chance of my daughter getting melanoma through the placenta. So I was beside myself because the thought of me having it was bad enough, let alone me transferring it to my daughter. But what I immediately called my radiation oncologist, and she said that was bad information. Yes, that there is a chance. It is one of the cancers that can, but it's less than 1% chance. So when we started getting Madeline followed, she was really, really young. And what the oncologist at BC Cancer told me was that because they were doing brain ultrasounds and chest x-rays and abdominal ultrasounds, and how he said it, described it, was that because when your child is really young, their cells, like a baby, their cells are developing so rapidly that if there was any melanoma cells in there, they would show up quite like immediately. So he said, if there has been nothing shows up by the time she's a year old. Plus they checked my placenta, and that was clear. They did biopsies of that. So he followed her till she was 19 months just to give me more peace of mind, and nothing was showing on any of her scans. So if your children are older now, and the only thing I can suggest, if you want to, so she goes to their dermatology program now once a year. But that was my concern, was it, and he reassured me because he said that would have developed very young. So, and she was clear on all of her scans. So I hope that helps.
Yeah, and feel free to reach out to us. We can continue this discussion of the webinar as well.
Yeah.
Okay, we've got a comment here. What an extraordinary conversation. Thank you. Are you able to name one really beautiful thing that has come from your experience with cancer?
I'm going to say it in one word: community. When I was diagnosed, I have an incredible family and lots of them. So I had the support I needed. And I always said I was kind of lucky. I've been married for, many years. I worked for an incredible company that had a good disability. So I was able to go off and get better. My kids were older. So I had a lot of good things in my life. But what I realized was everybody who had touched my life, or I had touched their life throughout those first 47 years, all came back into my life one way, shape, or form. Like people I hadn't spoke to in years. The accountant for my foundation, as a young man, I coached in baseball, when he was 10. Like the community was so important to me. But now with the Save Your Skin Foundation, as much as everybody tells me the wonderful things I give them, they'll never really know the things they give me, because in 2003, 5, and 7, I was so alone, even with my fabulous support family, that my community now, my new friends and family, are just as important, and I love them as much as my existing community of family. So to me, community is huge when you're dealing with any type of mental or physical issue. And so my word is community, and the person that asked that question is a big part of my community.
Does anyone else want to speak to that?
Yeah, I think for me, it really put into perspective, and really after working with all the youth that I've worked with on the downtown east side, who gave me a very good perspective on what really mattered in life, and not to sweat the small stuff because it's just small stuff. And it helped me just put things in perspective as what really mattered, and not to take anything for granted, because you just, as one of my first counselor at BC Cancer Agency said, don't worry about whether you're going to die from melanoma. It's easier said than done, because she said you could go out in a couple of weeks and get in a car accident or get hit by a bus, but then you worried all that time because you're so focused on your cancer that you just have to live every day and be thankful for everything you have in your life. And I remember one of the pediatricians that I used to see at Royal Columbian, he came up to me one day, and he was doing the rounds in the morning, and he said, he was an obstetrician, and he just came up to me and he said, I kind of envy you. And I wanted to punch him in the face, because I'm thinking, you envy me because I have melanoma and I'm pregnant, and but he said, because you will have such an amazing perspective on life that none of us have. And at first I was mad at him, but then I really understood that he's exactly right, because I value so much more in my life now than I ever did before, and community and relationships. And so that's, for me, that's, I would say, what good thing about having cancer is that's probably the biggest one.
Thank you. So we are at time. I do wonder, we have one last question. Are you willing to stay a few minutes longer to answer the last question? And for those who can't stay, be reassured, we will, this is being recorded, so we will send you, and you can always catch up for the last, with the last few questions when you receive the webinar recording. So last question, Shannon, Kathy, what one program or service would you like to see to enhance a recent melanoma patient's journey?
Well, I would like to say that I hope they get in touch with Save Your Skin right at
That's what I was going to say too.
Or if not Save Your Skin, to any other cancer organization, be it skin cancer, melanoma, or not. I think we play a really important role in so many ways. I hope we do. I think we do. And I think I always tell patients, you need to build a team, right? Your family and your physicians and that team. But I think, having an advocate there at the forefront can be really important. I think we get to do work behind the scenes that sometimes you don't even know or see or hear. But I would like to hope it's an organization that can be part of your team throughout the process.
I would agree with Kath, that just connecting. I mean, our best man at our wedding, he was the one, when I got my little mole diagnosed on my arm, he said, "Oh, don't worry. My Aunt Kathy she was given 3 months to live in 2003 or in 2005, and she's still here, and she's got this foundation." So, I think it's, and having that connection. And as soon as I went to stage 3, I looked her up and I called her up and said, "We got to meet for coffee." And that was the best decision I've ever made in my life. So
there you go. All right, well, we'll end it here. I want to say a huge thank you to our 4 presenters for sharing your insights with us. I really appreciate your time today and in preparation for the session. We know how important it is to Canadian patients and caregivers to have the opportunity to hear the stories of people who have gone through similar experiences and to create space for these types of conversations. And to our attendees, thank you for attending the webinar. Again, the session was recorded. I will be sending it to everyone who registered as soon as possible. It will also be on our YouTube channel in French and English and be on our website. If you have any additional questions, please email myself at marianne@saveyourskin.ca. So thank you so much for watching, and this ends the webinar. Ciao.
Good night, everyone.
Thank you.